COVID-19 positive cases are on the increase here in the Valley.
And with positive cases on the rise, so are hospitalizations. DeSherry McBroom explains what hospitals have been seeing over the last few months and the potential concerns moving forward. DeSherry.
Dana Mike, hospital officials say a combination of factors could be leading to the rise in cases, including large gatherings of unvaccinated individuals. As COVID cases rise throughout the Wabash Valley, the number of people entering the hospital to treat their positive case has risen as well, with Good Samaritan Hospital in Vincennes currently having 10 people hospitalized due to COVID. They have seen positive cases continue to rise this summer.
We've seen a dramatic increase in the number of positive COVID cases community-wide, really since 4th of July weekend. The last 30 days, Knox County has seen 195 positive cases. The 60 days prior to that, May and June, had a total of 49 positive cases.
Hospitals are seeing individuals who are both vaccinated and unvaccinated, but those who aren't have usually experienced worse symptoms.
Predominantly, the unvaccinated population is ending up in the hospital and unfortunately needing that level of care. Those vaccinated that are in that small percentage that do have breakthrough infections and symptoms and are testing positive are milder symptoms.
Caitlin Harvey, a nurse at Greene County General Hospital, is on the front lines of the pandemic and explains what she has seen over the last few weeks. As I assessed the first patient that had been vaccinated, I almost felt a weight lift off my shoulders. I walked in to find a patient that even though they were sick, they were not wearing oxygen, had a mild cough, and had an overall good assessment. I also unfortunately cared for patients that have not been vaccinated. These patients were very ill. These patients struggled doing very minimal tasks such as repositioning in bed, using the bathroom, eating, and talking, all while requiring high amounts of oxygen. Doctors and nurses who are on the front lines of the pandemic have had to deal with COVID in their personal lives as well, which at times has affected staffing options.
We are definitely experiencing more employees having to be out, having to be quarantined. We were at barely any, maybe 0 to 1 employee kind of here and there being out, and now we're up to 10 are out.
Hospital officials say though positive COVID case numbers are not what they were a year ago at the pandemic's peak, it is still a cause for concern.